Good afternoon, everyone. Let's start with a new topic about antibiotics and its perils. Okay. Now, before that, wanted to tell you, are you suffering from some now, or you can see that there are many people who are suffering from abdominal bloating. There is a distension of the abdomen. है ना, बहुत गैस बहुत होता है, स्टूल सही से पास नहीं होता, कभी कभी बहुत स्टूल हार्ड होता है, तो कभी कभी इतना लूज हो जाता है, कई बार मुझे जाना पड़ता है, ब्लोटिंग बहुत होते हैं. So what, there are so many reason for that, and one of the reason if you are taking a lot of antibiotics. So today's the new my topic will be antibiotics and its perils or its dangers, you can say. So before that, when we enters into the topics, let's see about what are the like bacteria which are present in the intestine. So our intestine contains a numerous means more than like thousands, or you can say numerous amount of the bacteria. Okay, so they are the Escherichia coli, Lactobacilli, Campylobacter. Okay, and other one is your biofidum bacterium. There are numerous bacteria, and this bacteria they act synergistically or they have very symbiotic relationship, very friendly way में वो लोग रहते हैं. Okay, they do not disturb, but they maintain the integrity of the like cells of the intestine, and this good bacteria or this good bacterial flora also help in digestion and also protect our body from the other pathogenic organisms or other bad bacteria. Okay. One of the bacteria is Lactobacillus acidophilus. Now, Lactobacillus acidophilus bacteria, which is living in the gut and the vagina, and they help in the prevent the invasion of the yeast and the other type of the organisms. Okay, so yeast infections. So whenever a person is suffering from a yeast infection, so vaginitis, or there is a candida albicans, white coating of the tongue. Okay, so that is a case of, you can think that a person is having this a good bacteria deficiency, mostly the Lactobacillus acidophilus. Now, this Lactobacillus acidophilus, they help in the digestion of the fat, and also help in the manufacturing of the some of the vitamins such as vitamin B1, B2, B3, and the folic acids. Okay, and also help in destroying some invading organism. Now there is another bacteria which is called as a Bifidobacterium bifidum. Usually they're found in the children who are the bottle fed, not the found in the children who are the breastfed, not in the bottle fed children. Now this Bifidobacterium is a helpful bacteria, and it is shown that after when the breastfeeding is reduced or it is stopped, now this bacteria is also comes down. Okay, so the children, especially those who are breastfed, they are having this good bacteria, Bifidum bacterium. Okay, now this bacterial flora, they attach in our intestine in such a manner that suppose this is an intestine. Now suppose this is intestine and these are the bacteria. So they are attached in such a way there will be no space in between this two bacteria, okay, or two bacterial floras. Okay, so suppose they are basically present in a very tight junction, so there will be a no gap. Now suppose if there is a gap, now like if you see this, suppose if there is a gap, then what happened, this type of the pathogenic bacteria that enters into the gut and they attached into the wall of the intestine and loses its and as a result the intestine loses its integrity. And this is why, because this type of the pathogenic bacteria or the opportunistic infections, they compete with the other intestinal organism for the nutrients, and this reduces the integrity of the intestine or the intestinal tract, which resulting in a disease called the leaky gut. Okay, so this is a disease where you can see that there is a gap, there is attachment or the tight junction has been there is a loose in between the two junctions, and as a result the resulting into the leaky gut. Okay, so what are the clinical features? If you find a person is suffering from the leaky gut, the main symptoms will be there will be digestive symptoms, that's in bloating, gas, abdominal cramp, diarrhea, constipation, and from food sensitive or the intolerance. Okay, so basically these are the symptoms of the IBS. Usually in those cases, a person who is taking a lot of antibiotics, antibiotics are good, but if you're taking a lot of antibiotics, they resulting into the leaky gut because the antibiotics not only destroy these like bad bacteria which you're suffering from, or they also destroy these good bacteria also. Okay, now so if you see, there is another clinical feature in like leaky gut. There will be fatigue, low energy, joint pains, muscles pain, headache, or the brain fag. So this fatigue and the low energy is usually due to the nutrition loss. Okay, we know that our intestine help in the digestion. So whatever we are taking in the via food, the intestine help in the absorptions of this nutrient from the food. And if there is a leaky gut, the person might be suffering, he or she is suffering from this diarrhea, which resulting into the loss of the nutrient, and that resulting in your bloating, fatigue, or the joint pains and all these things. Maybe they suffer from acne, eczema, or the rashes. These are all the main cause is your leaky gut. And what is the reason for that leaky gut? If you are suffering from chronic infections for prolonged period of time, for that you have taken a lot of medicines. Okay, so that resulting into the, especially the antibiotic and the broad spectrum antibiotics, this resulting in this type of this symptoms. So there is a nutritional deficiency and autoimmune flare up. Now, if you are suffering from any type of autoimmune disease, such as Hashimoto thyroiditis, rheumatoid arthritis, these type of the condition flare, okay, increases or aggravated. Told you before that antibiotics also causes an infections. It was found that a pregnant woman who was given antibiotics for her because she was suffering from bladder infections, and when she developed or when she delivered a child, they saw a white thrush on the tongue. So basically this is Candida albicans, one type of the yeast infections usually seen on those type of the children whose mother during her pregnant periods taken a lot of antibiotics. So this is one of the reasons that antibiotics also causes yeast infections, because the bacteria which are present, like lactobacillus, they basically they prevent the body from developing your yeast infections. If they are destroyed, your body but become more prone to that yeast or fungal infections. To know whether you are suffering from leaky gut or not, you should do one test which is known as your comprehensive stool analysis test. And this test is basically should be performed to assess the function of the digestive system. Okay. Now there is another like antibiotics and the nutrition loss already told. There is one book you can read that which was written by Leo Gallant. He says that if a person, if a child who is suffering from infections and every time he's taking antibiotics, that there is not only it lowered the magnesium level in the bodies by causing more diarrhea, but also they suffer from the zinc deficiency and the magnesium deficiency due to the recurrent infections. So this is a book, one of the very good book. You can read that, The Super Immunity from for Kids, written by the Leo Gallant. Okay. Now, there are some of the reasons. There is an article published in the American Journal of Medicine in the year of 1982. They report that the medicine, that is antibiotic tetracycline, it inhibit the white cells. We know that the WBC, the white blood cells, they basically destroy the pathogenic organism by phagocytosis, by engulfing the bacteria. It shows that the antibiotics called as tetracycline, it destroy the or ability, they destroy the ability of the white blood cells to engulf and destroy the bacteria. So might be white blood cell is okay, but their ability to phagocytosis, that to killing the bad bacteria, their ability decreases. There is another I'm not giving you some of the example, not every. Another example, they shows in the report in 1922 that trimethoprim, this type of the drug, they inhibit the antibody productions, okay? So inhibits the antibody productions. Now, these are the some of the antibodies. They also interfere with the oral contraceptives, the actions of the birth control pills. So these are some of the I just get this data from this internet only. So more likely to decrease the OC effectiveness, this type of the antibiotics, and less likely to decrease the OC effectiveness. The person who are sick, like the female who are taking oral contraceptive pills, do look into this. If you're taking any if you're taking any antibiotics, try to take a narrow spectrum antibiotics, not the broad spectrum one. Okay, so there are the some things which I wanted to let you know, that antibiotics do not kill viruses, they kill the bacteria. The person who is suffering from influenza, cold, flu, they should never ever be given for the antibiotics. So no need to give antibiotics for the cold and the flu. Only if the flu is complicated with the pneumonia, that time antibiotic is needed. Okay. So limit the number. What are the precautions? You should limit the number of the antibiotics in use. Do culture to confirm bacteria and identify the type. Sensitivity test to find the most effective antibiotic, and use a narrow spectrum antibiotic to protect the normal flora. If you're taking broad spectrum antibiotic, it causes more danger, or it causes more bad condition than that of the narrow spectrum antibiotics. So whenever you have a like small type of fevers or bacterial infections, try to go with the narrow spectrum antibiotic. Okay. Now, this is there is a Dr. Crook. He recommended that whenever he's like giving a broad spectrum antibiotic, he always giving a Nistin, a type of the antifungal infection which prevents the yeast overgrowth. So you can ask for your doctor that if he's prescribing any broad spectrum antibiotics, you can ask them if you give some antifungal also. Okay, or there are some type of the supplements such as lactobacillus acidophilus and bifidus to prevent the yeast infection, stomach upset, and the food intolerance. Along with the antibiotics, you can give in just to prevent its side effects. Okay, so this is all about but here my main motto is why you should improve your immunity so that you do not suffer from the infections. So there are the 50 ways to boost your immunity. For example, vitamin D that you easily get from the sun. Guess that is sunbathing is very good. The second is your laughing. Okay, it's a laughter is very, learn to say no whenever it is not, it is really needed. Okay, learn to say no, laugh as much as you can. The one of the very which decreases your immunity is suppressed anger and your stress. Maybe you're not having stress, but you have too much anger about anything. That also resulting in it also decreases your immunity. Sadness, grief, fear, these are some of the emotional things which also result in decreasing immunity. To try to avoid them as much as possible. Regular exercise, it can be of any form. Okay, walking, yogas, anything. And massage is also very good, along with the sauna with in the winter season. So these are the some of the, like, in this way you can increase your immunity, and always try to approach with, if even if there is an like some type of the fever, like small cold and cough, try to avoid antibiotics, and go with the natural mode of the treatment. Okay, you can go with any type of the holistic method, such as in homeopathy is there, to combat this type of the acute infections in a very, especially for the children and also for the adult. Okay, so so this is all about. To let me know if you need any information, you can type me in the chat box. Okay, so thank you everyone.